Hello everyone, how are you all? I hope you all are doing great. I'm back with another video. So 2 days back, I conducted a poll on PCOD symptoms, which PCOD symptom that you are going through. There were 4 options. One was irregular periods, the other was about skin and hair problems, and the third one was about weight problem, increasing weight, obesity, and fourth one was conceiving problem or a fertility problems. And imagine there were more than 60 to 70% said about irregular periods, and the other 10% about other issues. And I really wanted to talk about this because I know people are actually ignoring about these symptoms. Now, if you're planning for a conceiving, if you're planning to conceive and to reduce weight, think about it. You had a problem with irregular periods, isn't it? Think about it. You had a problem with some pimples or hair loss, but you ignored it at that time. Okay, especially when you're planning for a conceiving, usually now the ages that you are getting married at 24, at 25, and then conceiving planning for 28, 29. Already the age is already in that stage where it's difficult to conceive. Of course, it's not impossible. It's difficult to conceive after 30, isn't it? First thing, you ignored your irregular periods. Think about it. You had irregular periods, isn't it? If you're planning to conceive, ask yourself this question. You had weight problem before, but you ignored it. And let's come back to the skin problem. When we have irregular periods, we do not take care because it's not visible as a teenager, as a 20-22 age. We actually think only superficially. That means I have to look good, my hair should be good and everything. But when you start seeing about your skin problems, your hair loss, your facial hair, then you start thinking something wrong with my body. I'm not looking good. When you see in a mirror, then you lose your confidence and everything, isn't it? But you had a hormonal imbalance before. Did you think about that time? No, isn't it? We only think, as a female, including me, we think about beautification much. Once you start seeing visible symptom, then you start worrying about the problem. But when you see the problem from inside, you do not worry. It's okay, irregular period, it's okay. I don't want to go through that pain. I don't want to go through that bleeding every month. That's okay. You feel okay. And you will not have much knowledge about it, isn't it? But when you start seeing physically, when you start visually seeing the problem, then you realize, no, that's where I have a problem. Then I have to take it. Why do you ignore? So to tell everyone generally, please do not ignore. That doesn't mean that you take stress out of, oh, I have so much problem, etc., etc. Work towards your problem. Do not ignore your problem. I hope you're understanding my point of view, that don't reach a stage where you're not able to conceive. Trust me, PCOD is not a big deal that you have to go for medication or something, because there are many people, they have a facial hair, they have a pigmentation problem, they have a pimple. Start going for a synthetic medication, which is again not a good thing. That's not you start treating only symptomatic relief. Pimples are gone, then you feel that it's fine. No, there's some problem inside. There's a problem with the hormones. If you regulate those hormones, trust me, you will come out of this PCOD issue forever. But if you're not regulating it, you're only treating symptomatic reliefs. Symptoms, symptom that you take medication, you're getting periods, you feel that it is fine. You take medications, you feel that pimples are gone, you're fine. But it's going to affect in future to conceive, to other issues that you go through. Because main issue is to conceive, especially when you are going through PCOD. Please do not ignore. It's a request, but I don't want anyone to go through that, because I see a lot of fertility problem cases every day and I know what they are going through. And they will only realize when already crossing so many symptoms, but still they didn't realize. But when they plan for a baby, then they realize, isn't it? Don't do that. If you're in a stage of irregular periods, please take care of it. No synthetic medications. Take care of your lifestyle. Take care of your food habits, your stress level, your water intake, your sleep pattern. Work on these. Trust me, you will come out of this. It's not a big deal. So end of the video, I really want to say is don't take stress, but please work on it. Don't be ignorant about your symptoms. Work on it. You will come out of that issue. All the best. Stay healthy and stay happy.